Lindsay. I'm Tracy. I'm your nurse practitioner today, and I'm going to do an assessment on you. My medical assistant checked your vital signs and did a Snellen with you, and so your eyesight's looking good, and your vital signs are stable and within normal limits. Do you have any questions?
No.
Okay, so I've washed my hands. I've got my equipment all set up here, and I'm just going to do a head, neck, and chest exam on you. Do you have to go to the bathroom or anything?
No.
Okay, perfect. And I've assured privacy. So I'm going to get started. If you have any questions, let me know. And I'm going to be kind of talking through what I'm doing so that you know what's going on, okay?
Perfect.
So I'm going to start with your head, and we're just going to check for any lumps, bumps, any pain in any of these areas?
No.
Okay, looking at your hair for the texture, the distribution, and color. Everything looks good. So I'm going to be looking at your face. I'm looking for symmetry to make sure both sides are the same, and I'm looking for any involuntary movements, which I don't see. I'm looking at your eyebrows and your eyelashes, and we're looking at your eyebrows to make sure they're symmetric and they're not hyperextending past your eyes, which everything looks good. And could you just make some faces for me? Lift your eyebrows up, puff out your cheeks. Okay, making sure those muscles in your face are working properly and symmetrically. Looks good. So what we're gonna do now is I'm gonna touch gently to your forehead, your face, and your chin, and you let me know if there's any different sensation you feel on one side or the other. What we're looking is that they're the same on both sides.
Yeah.
So can you feel it on both sides?
Yes.
Okay.
Yes.
And same on both sides, no difference, no different sensation. Okay. So now what we're gonna do is I'm gonna check your TMJ, your temporal mandibular joint. So if you could open your mouth and close it, okay, side to side, in a circle, perfect. I'm listening for any clicks or anything. I don't hear anything. It sounds good. The joint looks good and it's got full range of motion. Perfect. So now what I'm going to do is I'm actually going to just, we're going to check your visual fields to make sure that everything looks good. So if you could put that over your right eye, okay? What I want you to do is when you see my finger come into focus, let me know.
No.
Okay, now let's do the other eye. Okay.
No.
Perfect. And I'm going to check now for extraocular movement. So I want you to just keep your head still and I want you to follow my finger with your eyes. Good. So that looks good. Okay. So now what we're going to do is I'm just going to check, make sure that your pupils are equal and reactive to light. So if you could just look straight ahead. Okay. And they are equal and reactive to light. Size-wise, now we're going to check consensual reaction. So what I want to see happen is when this eye dilates, this one is also dilating from the light. Okay, consensual and direct is looking good. Same with this one. Consensual and direct look good. Perfect. So I'm also, one of the things I want to check is I'm going to check your conjunctiva and your sclera to make sure everything looks good. And I see that it's pink and it's got good vascular. There's no erythema. Everything looks good. That's perfect. So what I'm going to do now is we're going to get a little bit deeper look. This is called a fundoscopic exam. And this is going to show me in behind your eye so that we can check for any hemorrhaging, any wool spots, anything like that. So if you can look straight ahead. First thing, I'm going to put my hand on your shoulder just to steady myself. I'm looking for a red reflex, and I have that. Okay, and it looks good. No hemorrhaging or wool spots. I'm going to do the same for the other eye. I'm just going to put my hand right here. I'm checking for a red reflex. There it is. Getting a little closer. Okay. In the back, I don't see any hemorrhaging or wool spots. Great, perfect. So now what we're gonna do is I'm just gonna check your ears and see if, I'm gonna check inside your ears, but I also wanna check and see if there's any tenderness, any pain with your auricle or your tragus. Perfect. I'm gonna look in your ears and do an internal exam. So what I'm gonna do is I'm just gonna rest my pinky on your face. I'm gonna pull your lid back and up, your earlobe. Okay, looks good. Your canal is clear. Your tympanic membrane is pearly gray, and your cone of light is 5. Perfect. Now we're gonna check the other one. Okay. Okay, so I'm going to check the tragus and the auricle for any pain or discomfort. Anything?
No.
Perfect. I'm going to pull back and up. And there is your clear canal. Your tympanic membrane is pearly gray. Your cone of light is at 7. Looks good. Perfect. So now I'm just going to do a little gross hearing test. So I'm going to just squeeze on that. Repeat the word that I'm saying.
99.
Okay. Do it on this side.
99.
Perfect. Now I'm going to do what we call the Renee and Weber test. And so what I'm going to do is this is a tuning fork, and I'm going to place it on your head, and you're going to let me know if you can hear the sound in both ears, stronger in one than the other. What we're looking for is equal hearing on both sides, okay?
Yeah.
Both sides?
Both sides equal.
Perfect. So now what we're going to do is I'm going to put it on the bone in the back of your ear, and this is going to tell me whether we're going to see how you hear through bone transmission and through air, okay? So what I want you to do is let me know when you stop hearing the sound. When I do this, and then when I put it in the front, same thing. Let me know when the sound stops.
Now. Now.
Okay. And you definitely hear the sound more or longer in your when it's in the front, and that's because air transmits better than bone. Most people.
Now. Now.
Okay, perfect. Now what I'm going to do is I'm actually just going to looking to check your sinuses. So any pressure or pain there?
No.
Okay, good. And I'm looking at your nose to make sure the septum is in line and not deviated. I'm actually going to look in your nose and that the bones are straight. Everything looks good. All right, if you could look up just a little bit, I'm just going to look in your nose. Okay, your septum is in line. Pink. No erythema noted. A little bit of purulent drainage, nothing big. Same with this nostril. Okay, the septum's in line. It's pinkish, no erythema, clear, no purulent drainage in there. Looks good. All right. So now what we're gonna do is I'm gonna check your lymph nodes and make sure that there's no swollen lymph nodes, anything like that. So I'm gonna start palpating from the back of the skull where your occipital lobe is, because that's where we have some lymph nodes. And then I'm gonna palpate all the way to the front. You have lymph nodes behind your ears or in front. And palpate down your neck and your clavicle. Everything is good. Perfect. So what I want you to do now is if you could just look up a little bit, because I'm going to check your trachea for alignment, making sure that it's in line. And it looks good. Everything looks good. Perfect. I'm not looking at it. I'm not seeing any swelling or any nodules or anything like that sticking out, so that's good. What I'd like you to do is I'm going to check your thyroid, and I want you to swallow when I ask you to. So we're going to get the placement. I'm just going to push your trachea over a bit. I'm going to palpate. If you could take a drink of water. Perfect. Your muscles swallowing are good. Okay, we're going to push over and do it again. Palpate your thyroid. Okay, perfect. Good, good. I'm not feeling any protrusions or nodules or anything like that. Now I'm going to check your mouth, And if you could just smile, your teeth look good. Perfect. What I'm going to do is I'm going to have you open your mouth and I'm going to check the back of your throat. I'm going to check your uvula and your tonsils. If you could just open your mouth. Okay. Say ah. Say ah. Okay, your gag reflex is working good. I'm going to just try and get your uvula. Looks good. Your tonsils are 1+. Your top of your mouth, the bridge of your mouth is pink. Everything looks good. There's no erythema, no lesions. Your teeth look good. If you could put your tongue to the top of your mouth, everything looks good. No lesions or anything. No erythema. Looks good. And your tongue, if you could just, there we go. So your tongue muscles are working pretty good too. Fantastic. All right. So now what I'd like you to do is, I just want to check a few of the muscles. If you could turn your head to the side, back, front. Lift those shoulders, side to side. Yeah, you got it. Perfect. Like you're 5 steps ahead of me. So now we're gonna do a chest and lung exam, okay? And what I'm gonna start with is I'm actually just gonna start, if you could swing your legs to the side. I'm actually just looking for any lumps or bumps. Ideally, if you had your shirt off, that would be great. But since you don't, I'm just checking for any lumps or bumps or anything out of the abnormal. Okay, everything looks good. So now I'm just going to come around here and I'm going to check for the tactile fremetus. And basically what that is I'm just checking to make sure that I'm hearing the vibration of your voice. And if you could say 99, and when I get my hand to where it's positioned, let me know. Or I'll tell you, say 99.
99. 99. 99. 99. 99. 99.
Perfect. And if you could put your arms up so I can listen laterally.
99. 99.
Perfect. So now I'm going to do the thoracic expansion, and what that basically is I'm checking to make sure that your breathing is even and symmetric from the right to left. I'm going in at your 10th rib, and I'm just going to give myself a little bit of slack so that I can, okay. So if you could just breathe. Okay. And they're going up equally. One hand's not rising and the other one's not. They're both symmetric, so that tells me that your rate of breathing is good. As we've been doing this, I've been watching, and your rate and rhythm is good. I'm noting that you're not in any respiratory distress, that your breaths are even and equal, and your respirations are good. So now what we're going to do is I'm going to percuss your lung field. So if you could just lean forward for me. I'm just going to percuss the lung fields. I'm trying to avoid the scapula. Because I want to check the left and right. Perfect. So now what we're going to do is we're going to do the diaphragmatic excursion. And that's basically checking to see, I'm going to have you inhale and I'm going to check, and then I'm going to have you exhale and hold it and check, okay? So if you could just take a deep breath, inhale, and then hold it. Okay, and that's where it is. I'm actually going to lift your shirt if you don't mind, where the line is. Okay, so okay, you can release your breath. Okay, and then take another deep breath, inhale and hold it. Okay, that's where I'm hearing it go from resonant to dull, and just take a couple of breaths, fine, get your air back. And then what I'm going to have you do is take a couple deep breaths out, and I'm going to have you I'm going to have you breathe out, and then I'm going to have you hold it, okay? Okay, hold it there for me. And I'm going to palpate going up from that mark. And there's where, okay. There it is. Perfect. So it's even on both sides. Perfect. And it would be wider if you were in sports and had really great lung expansion. All right, so now what I'm gonna do is I'm just going to listen, and when the diaphragm of my stethoscope hits your back, just take a deep breath in and out. Perfect. All right, if you could flip your legs back around again, we'll do the front. And again, I'm just assessing for your rate and rhythm of breathing. I'm making sure that there's no respiratory distress. And again, what I'm going to do is I'm going to put my diaphragm. And when I do that, I want you to just take a deep breath in and out. And I'm going to start up here. Making sure the left and right are equal. Okay, and if you could lift your breast tissue up for me, I'm just gonna. Perfect. All right. Do you have any questions?
No.
All right, everything looks good. You looking to be in great shape, and I will see you at a different time.
Okay,
All
thank
right.
you.